as I was saying, in some scenarios, some situations, you might have a patient who seems a little bit hesitant. So even though they've booked the appointment to come and see you because they have a symptom that they want to discuss with you, so they've obviously come to you for that purpose, right? But at the start, they might seem a little bit hesitant, or they might say it's a personal problem, or it's a little bit embarrassing, or they seem like they're a little bit embarrassed, right? It's important to identify this point, that is it reassurance that they need, or is it about confidentiality? And a lot of students make the mistake that they go in with confidentiality. You need to understand the difference between when is it appropriate to reassure a patient, right? And when is it actually needed to talk about confidentiality. And the patient wouldn't book an appointment to come to you about a problem if it was something they don't want to open up about. So this is not about confidentiality. It is just that they're saying, I'm a little bit embarrassed, it's a bit of a personal problem. So we need to give them reassurance. So how can we give them reassurance? We can say something like, well, you did the right thing by coming to talk about the problem. I'm here to help you. So if you could just open up, as doctors, we deal with all kinds of problems. If you could open up and tell me, I can help you better, right? So what have you done? You've reassured them. And then they'll feel much more comfortable with you, and then they'll open up with you, right? Confidentiality is usually, let's say, now obviously this was a scenario about a woman presenting, 35-year-old female presenting with a vaginal discharge, right? And then you explored it nicely. But let's say when you reached the point of asking about her sexual activity, and you asked her, are you sexually active? And she answered with, yes, doctor, I'm married for the last 5 years to my husband, right? Now, you did the right thing by exploring, because we can't just assume that's her only sexual partner. So obviously we have to very sensitively say, I'm very sorry, but it is important for me to ask, by any chance, have you had any other sexual partners apart from your husband in the last 6 months? Now at this point, if you see that she's fidgeting and she's nervous and she's not opening up, this would be a point where you need to talk about confidentiality, right? And then you would do that with that caveat that we've talked about, where you would say that, I can see there's something on your mind, you seem to be hesitating. Please rest assured, everything we discuss will remain confidential unless you or anyone else is at risk of harm. And now that you've offered that confidentiality, they will open up and tell you that, yes, actually, I had a one-night stand or something like that, right? So this is a difference between reassurance and confidentiality. So make sure you understand when to use which one, all right?